Just a few years ago, I realized how important it was to see someone to clean my teeth who could provide me the special care that I needed as a patient with a bleeding disorder. I owe a lot to my hematologist in the treatment center for their advice and their help and their care.
Many of these patients would just go and not tell the dentist that they have an issue and just try to deal with it afterwards. And that's one of the reasons the center brought on a hygienist. They're just fearful. They've grown up in where they've had bad experiences, just things that we have to deal with on an emergent side instead of a preventive side.
Janice is a hygienist here. She has an extensive history of patients with bleeding disorders due to the fact that she has someone in her family that has a bleeding disorder. She also works at the treatment center.
He has problems getting dental care because of, he's just had some bad experiences. And so and when he has a problem, it's very costly. So instead of trying to work through dental offices, Dr. Sanders has offered to do his dental care, and I come specifically to see Eric.
Janet and I have worked for many years with patients with bleeding disorders, and we work together as a team in terms of the appropriate management of the patient's particular dental issues that come up.
I feel a lot more comfort in the fact that she's the one cleaning my teeth. She has a better idea of knowing what to look for when there's going to be an issue.
It would be nice if we had all the dentists on board treating patients with bleeding disorders. I think a lot of dentists are a little fearful, and I think because of that, it's difficult to find dentists that want to take the time to do that.
It starts with educating my colleagues and getting them the information out there so they can feel comfortable. And I think if you have that level of communication, pretty much any dentist is capable of treating patients with bleeding disorders. You don't have to have a specific specialty to manage those patients.
We try to encourage routine dental care. By doing so, it eliminates the emotional stress that patients go through and also the financial stress that goes along with a lot of dental needs.
The importance of identifying dental problems, particularly patients with bleeding disorders, identifying them early on and to prevent dental problems. It minimizes the complications or potential complications that you could have with bleeding, and that's the reason we want early care, early preventive care.
We increasingly get better at managing the patients, and the patients get better at understanding the importance of routine care, how it's less costly for them and how it's better for them.